HIV is a virus, that's a retrovirus, and there are two types, HIV-1 and HIV-2. By and large, globally, it's the HIV-1 which is responsible for epidemic. HIV-2 is limited to few countries of the Africa only, and there are few cases. So most of it is HIV-1, which is prevalent around the globe. As far as the treatment is concerned, we have got strong diagnostic tools whereby the disease can be diagnosed within 3 to 4 days of exposure. We also know the severity of the disease by doing the viral load testing as well by PCR. As far as the treatment part is concerned, there are certain treatment strategies. Very effective antiretroviral treatment is also available, but that disease is not curable, it's controllable. So one person can live a normal life who is HIV infected if that person keeps continue taking the medications for the rest of life. So the life expectancy remains normal when somebody is taking proper antiretroviral therapy. Increased number of cases in Pakistan. Pakistan is one of the few countries in which there is an increasing HIV infection trend. And HIV infection trend is increasing all across the country, right from Islamabad and Peshawar to Karachi. The most important reason, to the best of my knowledge and understanding, is that we do not have proper education system. So these high risk sexual behaviors still continue, particularly in males having sex with men, as well as transgender sex workers. There is very little spread amongst female sex workers, fortunately. Another important segment is unsafe blood and injection practices. Blood transfusion services are not 100% safe over here, because some of the blood transfusion centers use the technology which is not very sensitive and which may miss several HIV positives, and these bloods are transfused. Another is reuse of injection and syringes, which has been responsible for a large epidemics, particularly in certain parts of Sindh, Larkana and Ratodero. Another important is the reuse of the injections and syringes by intravenous drug abusers. Drug users use these and they share their syringes. So if somebody is infected, one person is infected, the whole group gets infection. This is the reason that we are also having a large number of hepatitis B and C positivity along with HIV positivity in intravenous drug users. To some extent yes, and to some extent no. The health system, Pakistan is very, very fragmented. Almost 30 to 40% of the healthcare is being provided at the public sector or government hospitals and healthcare facilities. The remaining is shared between the NGO sector and private sector. Unfortunately, the private sector and private practitioners, there are doctors who are doing their private practice as well as there are quacks. And number of quacks in Pakistan is in hundreds, thousands, almost 600,000 quacks are practicing. So you can very well understand the level of their knowledge, and they reuse injections and syringes. Similarly, the barbers over here in Pakistan, they use the blades or razors which are reused. So all of these are responsible for blood-borne infections. Health sector has not been come up to the expectations, but fortunately Since the international donor agencies like Global Fund, UNDP and several others, they support HIV infection diagnosis right from diagnosis to treatment. So diagnosis, treatment, all facilities are available across the country free of charge. The lack of awareness, due to lack of awareness, people don't avail those facilities, and that's why it's spreading at a rapid rate. You know that the international donors, what they fund is very, very limited, and it generally supports the government. The international funding comes to fill the gap in which the government services the gaps are there. But unfortunately, government is not taking the lead and not taking the responsibility of providing all those services. So the donor funding is very, very limited to certain aspects of, for example, diagnosis and treatment. But they are not geared towards educating the masses, to have the programs in all the healthcare facilities, to run the academic as well as training programs, to educate masses, the mass media publicity. All those things are not in the purview of the international donors. And we can never depend on the international donors to support the program. That has to be done by the system, by the healthcare system, and government can also seek support from the private healthcare sector as well, NGO health sector as well. But it is the primary responsibility of all of us and not the international donors. Yes, homosexuality is, and male sex workers, we call them as well as transgender sex workers, they are indulged in homosexuality, and it is responsible because the sexual activity increases, and particularly the anal sex increases the chances of HIV transmission manyfold. Yes, HIV person remains normal, HIV infected person remains normal after infection for several months to several years. And those people who are infected and who are diagnosed and who are getting treatment, they can remain healthy for the rest of their life if they continue taking medications as advised. You see, just the knowledge or information of somebody that an individual is HIV infected is a great psychological trauma, not only to the individual but to the family as well. And that's why it is always good to have a psychological support. Moreover, the person has to learn to live with the HIV positivity. For example, in the sexual life, family life, relationship with the spouse, all these things has certain problems, and those problems needs to be addressed so that the infection is not transmitted from husband to wife or vice versa. Similarly, there are certain areas of stigma and discrimination, and that adds to the burden of the psychological trauma to that individual who is infected. So it's always better to get a psychological help and support so that those effects can be minimized. Globally, World Health Organization as well as all other international agencies, they are targeting that HIV infection should be minimized, and this decade of 2021 to 2030 is a decade of action. And all the actions people are taking, the governments are taking, the international donors are taking, is to curb the new infections. And the target is that there should be 95% reduction in the new infection by 2030. 95% of the individuals should be aware of their HIV status, and 95% of those people who are HIV positive should be getting treatment for HIV infections. So this is the target, and many countries are approaching towards this target very rapidly. we are in Pakistan unfortunate that we are not only progressing in the right direction, in fact we are going in the reverse direction, and our new HIV infections are increasing. The awareness of HIV status is again stays the same, it is not increasing, and those people who are infected